Good morning, everyone. I'm Gustavo Bacelar. I'm an ophthalmologist. I'm also, I've been working on the last 7 years on medical informatics. Actually, I came from Brazil to here to Portugal to study, to attend a master's degree in medical informatics. So today I'm gonna bring to you some promises and challenges for the future of electronic health records. Well, the first one is the healthcare data portability. When some years ago, actually, when most of the records were paper-based records, it was very difficult to give the record for the patient, so the patient could store it and bring it on the next appointment. So we used to keep it. The institutions kept the information. It was safer for the institutions and for the patients. But we have a different scenario today. We have different solutions for the storage of data. But we are still facing the same issue, that is, our health data is distributed all over the different places, the different institutions we were attended. So we still use it, we still have the same habits of paper-based times, but we have a different scenario today. We have the electronic health records. So that's the main point of the healthcare data portability. It's very important for the patients to have access to their data and to make it available for the other doctors when he goes to a different doctor. And despite it may seem a little bit weird for us, there is already an European data regulation that mentions this kind of data, the healthcare data, to be available for the patient as the patient asks for it. So the hospital or the clinic is obliged to forward the request of the patient in a structured, commonly used, and machine-readable format. So that leads us to another aspect, to another point, that is, we need to have better interoperability. Well, I don't know how many of you are using electronic health record. I think most of you are. But I don't know how many of you experience to try to change your electronic health record. Well, they're made by different people, and each electronic health record, each system has different languages. I can say that. They don't speak the same language. If we want to communicate them, to change information between them, we need to make translations, and the translations aren't always perfect. So they're not able to communicate. So as an example, we have different ways to store the intraocular pressure, even to mention it, different ways to name it. We can use IOP, we can use intraocular pressure, we can use a single field to record it, or for both eyes, or we can separate them. And that also leads to a problem, that is the vendor lock-in. If someone has already tried to change the system, I think you have discovered that you are almost locked with the system vendor. It's a proprietary system, so it's very difficult to change. So the idea nowadays is to separate the EHR from the data from the system. So we will have the data in the system. The data will be structured according to an open access standard, and the system can use this structure to perform your system, your personalized system. This is an example of the OpenAir, which is the most famous one and most used too. It also inspired an ISO. It's the ISO 13606, and this is the piece of, it's the artifact that can be used to store the intraoptimal pressure. This artifact is called archetype. It can be translated into different languages and can be used automatically according to the country, the language of the country. So we don't need to use all of it, but we have here everything we need to record the intraoptimal pressure. So if different systems use this archetype to store the intraoptimal pressure, they will be able to communicate with them in a deeper level of semantics. It's the semantic level, it's the semantic interoperability. So this leads us to another issue that we need to address, that is to build better clinical decision support systems. Nowadays, it's very difficult to build very good and disseminated clinical decision systems. Why? Because we have different systems, and if we want to create a good one clinical decision system, we'll create for only one system. It will not be compatible with all the others. So we have a lot of guidelines, a lot of clinical guidelines. How can we use it in our daily practice? How can we use them at the moment of care? How can we have access to this information? Well, if we use this kind of artifacts, this kind of standard, it will be easier. Actually there is already a tool to build it. We can have the guidelines available with a file that can be used in a EHR, and this file can be used to be inside a clinical decision support system. So we will be able to compare these recommendations of each guideline. I've actually seen this in Sweden when I was there during the master's degree. My co-supervisor was there, and he was able to compare the Swedish and the European stroke guidelines. So he was able to access the hospital database, and he was able to see which doctors followed each one of these guidelines and their result. So that's all I have to bring to you today. Thank you for your attention.